PCNL in horseshoe kidney. 42-year-old lady with 3 stones in the left compartment in horseshoe kidney. The preoperative non-contrast CT on abdomen and pelvis show a stone in the renal pelvis of the left compartment of horseshoe kidney, measuring to 0.6 by 0.1 centimeter, and to smaller stones in the lower calyx. The density of the stones are 700 Hounsfield unit. Tips of PCNL puncture in horseshoe kidney. The horseshoe kidney is located lower than the normal kidney. So, the upper calyceal puncture in horseshoe kidney is usually subcostal, not supracostal. Horseshoe kidney is malrotated. The renal pelvis is facing anteriorly. Because of this malrotation, renal pelvis may overlap some calyces in anteroposterior view. So, sometimes the monoplanar anteroposterior view may be insufficient for adequate visualization. The use of oblique view with C-arm fluoroscopy can provide additional anatomical details about the renal calyces. The upper and middle calyces in horseshoe kidney are lateral to the ureter, while the lower calyx is medial to the ureter. So, the lower calyceal puncture should be avoided due to poor accessibility and high risk of vascular injury. Upper calyceal puncture is the preferred calyx in horseshoe kidney and give optimum access to the majority of collecting system. Middle calyceal puncture is needed in some cases of horseshoe kidney. Lower calyceal puncture should be avoided in horseshoe kidney. Now, back to our case, started by fixation of the ureteric catheter and retrograde pyelography. Retrograde pyelography shows the anteriorly malrotated system. The upper calyceal puncture is a targeted calyx in this case. Passing the J-tip guide wire in the ureter. Dilatation of the tract by single-step dilator. Ensure that the long instruments and long nephroscopy are available. Notice the long tract from the upper calyx to the stone in the renal pelvis. The stone looks soft and friable. So, the main bulk of the stone is sucked out by ultrasound. Using the forceps to extract the stone fragments. Finish the renal pelvis stone, then look for the stones in the lower calyx. The neck of the lower calyx is located medial. Ultrasound disintegration and forceps extraction of the stones. Final scanning and fixation of the nephrostomy tube. The post-operative control film, non-contrast CT, is free.